necrotizing fasciitis, which during the process of doing research for this video, I proceeded to call it necrotizing fasciitis, which is embarrassing, but you will probably notice that I will butcher a few of the names in this video. I don't really have defense for that. That's, I don't know, I'll try my best. Anyways, necrotizing fasciitis is a bacteria that eats your flesh. And it's a pretty bad bacteria. I'm gonna put my laptop on the side here so I can see what I'm trying to say. Necrotizing fasciitis means decaying infection of the fascia, which is a soft tissue that is part of the connective tissue system that runs throughout the body. For those who don't know, connective tissue is one of the 4 primary types of animal tissues, along with epithelial tissue, muscle tissue, and nervous tissue. Those are, I'll put them right here. You can see all 4 of them right there. The thing can develop mostly, what is that word, bro? Mesenchyme? Mesenchyme.
Mesenchyme.
Mesenchyme?
Mesenchyme. Mesenchyme.
Mesenchyme. Develops mostly from the mesenchyme, derived from the mesoderm, which is the middle embryonic germ layer. And connective tissues are pretty much just found in between other tissues everywhere in the body, including the nervous system. And the term connective tissue in German, Bindegewebe, bro. Bindiga Viva? Bindiga Viva. Bindiga Viva? 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 I could not pronounce that. I tried looking for somebody that teaches me how to pronounce that, and I couldn't find it because it was one guy repeating the same poorly recorded audio multiple times. So it was introduced in 1830 by Johannes Peter Muller. The tissue was already recognized as a distinct class in the 18th century. Typically, the infection enters the body through a break in the skin, so like a cut or like an animal bite or something. And like risk factors include a poor immune function. So like if you have diabetes, cancer, obesity, or if you're obese or you're struggling with alcoholism, all of those can lead to necrotizing fasciitis, which kind of sucks because all of those are relatively common. Immune issues tends to occur in about 4 people per million per year. So like there's 1 million people and 4 of them get it every year. That's what it's trying to say. In the US, that's in the US alone. And 1 per 10 million in Western Europe, that's insane. Both sexes are affected equally, and it becomes more common among older people and is rare in children, although it does happen. Symptoms of the thing may include fever, swelling, and complaints of excessive pain in like in a specific area or in a specific limb or whatever. The initial skin changes are similar to cellulitis, thus making the diagnosis at early stages difficult. The thing about this bacteria is that it starts off very mild looking. It looks like a dead skin or something else, which later on obviously turns out to be a flesh-eating disease, and which is arguably not very good. Hardening of the skin and soft tissue and swelling beyond the area of skin changes are commonly present in those with early necrotizing changes. More than 70% of cases are recorded in people with at least one of the before mentioned clinical situations, but here are a few more. Immunosuppression, diabetes, alcoholism/drug abuse, smoking, and chronic symptom diseases. For reasons that are unclear, it occasionally occurs in people with an apparently normal genetic condition. So, even though it is, or per usual, you usually will get it if you have one of those defects, it can occur in just like anyone, which is terrifying. Necrotizing fasciitis can occur in any part of the body, but it is more commonly seen at the extremities, for example, the genitals or limbs, and only a few of such cases arise from the chest or abdomen. Trauma, as a physical trauma, is the usual cause of the infection, such as from intravenous drug injection, insulin injection, animal and insect bites, and etc. There are several types, similar to diabetes, where you have type 1, type 2, type 3, etc. For here, there's, I believe, 6 or 5. The first one is the type 1 infection, and it's the most common type of infection, and it occurs for 70 to 80% of cases. It's caused by a mixture of bacterial types, usually in the abdominal or groin areas. This type of infection is usually caused by various species of, these words are gonna be difficult to read, but I'm gonna give it a shot. So it is usually caused by various species of gram-positive cocky, which is Staphylococcus aureus, Streptococcus poigenis, be mature, and enterococci. Clostridial infection accounts for 10% of type 1 infection. Clostridium species involved are Clostridium perfringens, Clostridium septicum, and Clostridium sordelli, which typically cause gas gangrene, also known as myonecrosis. Clostridium perfringens produces 2 deadly toxins, alpha toxin and theta toxin. Alpha toxin causes excessive platelet aggression, which blocks blood vessels and deprives the vital organs of oxygen supply. This creates an acidic, oxygen-deficient environment for the proliferation of bacteria. When alpha toxin is absorbed by soft tissues, it can inhibit the migration of white blood cells from blood vessels into the soft tissues, thus impairing phagocyte function. The 2 toxins together can cause destruction of red blood cells in blood vessels, damage to the integrity of blood vessels, and suppression of heart function, which is also not good. Type 2 infection, this infection accounts for 20 to 30% of cases, mainly involving the extremities. This mainly involves You know what, I'm just gonna search up how to say this so you guys don't keep laughing at me and I don't embarrass myself. Give me a second. Oh, that's.
Streptococcus.
Oh, wait, no, I was right. I thought it was streptococcus. No, it is streptococcus. I was right.
Streptococcus. Streptococcus.
All right, moving on. This mainly involves Streptococcus pyogenes bacteria alone or in combination with Staphylococci infections. Both types of bacteria can progress rapidly and manifest as toxic shock syndrome. Streptococcus species produce M protein, which acts as a superantigen, stimulating a massive systemic immune response, which is not effective against the bacterial antigen, precipitating shock. Type 2 infection more commonly affects young, healthy adults with a history of injury. Type 3 infection, Vibrio vulnificus. A bacterium found in salt water. It is a rare cause of this infection, which occurs through a break in the skin. Disease progression is similar to type 2, but sometimes with little visible skin changes. Type 4. Type 4 infection, which accounts for less than 1% of cases, is caused by Candida albicans fungus. Risk factors include age and immunodeficiency. Types of soft tissue necrotizing infection can be divided into 4 classes according to the types of bacteria infecting the soft tissue. This classification system was first described by Giuliano and his colleagues in 1977. The bacteria gets worse quickly, destroys your tissue, and causing things like organ failure, even with treatment. 1 out of 3 people dies from this disease, and you may need more than 1 surgery to manage necrotizing fasciitis, and you may or definitely will have scarring. Now, I am about to put some pictures up so you know the extent of what this disease can do to the human body, and I will warn you, they are very graphic. So, here's one. Here's another. Here's another. Yikes. And then most people need to have several surgeries to control the infection. Removing limbs, amputation, or organs may be done to save the person's life. Depending on how severe the infection is, when and where it has spread, medicines such as antibiotics can kill the bacteria causing the infection. At first, you may have intense pain or loss of feeling near a cut or wound. The pain may seem much worse than you would usually expect from a cut or wound. Swelling of the skin around the affected area. Flu-like symptoms such as high temperature, headache, or tiredness. A Confederate Army surgeon, Joseph Jones, is generally credited to have provided the first modern description of necrotizing fasciitis, then known as hospital gangrene. This is a soft tissue infection characterized by a rapid and progressive course in the 1990s. This entity has been popularized in media as representing infection with the flesh-eating bacteria. Certain patients are at particular risk to develop necrotizing soft tissue infections. Those with impaired immunity, diabetes, etc., drug abuse, particularly vulnerable. But these infections can also occur in previously healthy participants. Diagnostic radiographic testing is often helpful, including the use of plain radiographs, computer tomographic, or a CT scan, which you might have heard it, or a CAT scan. Scan the magnetic resonance imaging, or an MRI. And the most frequent infection bacterial organism is a group A beta, like I mentioned earlier, hemolytic streptococcus, which there are indications to suggest that this organism may be acquiring greater virulence. Many infections, however, involve several bacterial pathogens. The keys to successful outcome are early diagnosis and surgical debridement, fluid resuscitation, and administration of broad spectrum antibiotics should be initiated as soon as the diagnosis is suspected. So, the Centers for Disease Control (CDC) estimates there are 700 to 1,200 cases of necrotizing fasciitis per year in the U.S. alone. Most people who get the disease have other health problems, like I mentioned before. So that was like a little showcase of, or a little explanation of what actually happens when necrotizing fasciitis occurs. But some of you might be wondering, I bet half of you aren't, what's an example of a few specific cases or some people that have described, like how have people described it, people who have had it? Here are a few basic survivor stories on how they felt. These are very short, but all of these come from the Necrotizing Fasciitis Foundation. So one person here says, I figured it was the start of a flu because of how I was starting to get a fever. Somebody else says that I got back into bed and I was in horrific pain. I was shivering uncomfortably. Any move I made felt like knives were digging into my body. Someone else's is, this year has been hell for all of us, but I'm ready to see what the future brings. If I can survive necrotizing fasciitis, I can accomplish anything. Somebody else says, my family was told to gather because my prognosis wasn't good. So there are a few basic victim descriptions. The one that I wanted to elaborate on a little bit was the one where they described it as feeling like knives were digging into their body. And now the reason why necrotizing fasciitis is so hard to catch is because when it starts off, like right when it starts off, when it hasn't gotten that bad yet, it looks like this. It looks like a really, really, really bad bee sting or something. It's almost, it's bizarre that something like this can become something like this. It literally rots you down to the bone, which obviously is gonna be very painful. There was a little description of and history of necrotizing fasciitis, how it was discovered, who discovered it, and yeah, I would like to cite my sources here were Wikipedia, the Necrotizing Fasciitis Foundation, and a few other medical research institutions. If anybody has any questions about the bacteria, I would love to hear them, and I hope that you don't get necrotizing fasciitis. What was your experience with necrotizing fasciitis, or what did you do? What was your profession at the time?
My profession?
Yeah.
Well, I'm an anthropologist,
Mm-hmm.
and I was active. I mean, I was doing field work,
Mm-hmm.
but I don't know exactly how I got this situation. I really don't.
Mm-hmm. Do you
I
believe?
remember.
Sorry.
No, I remember I was moving some furniture in the house, and I accidentally hurt my right thumb.
Mm-hmm.
And I said, oh, this doesn't look good, because immediately it started like reacting and turned to a funny color.
Mm-hmm.
But 2 days later, I was talking to a friend. I had a little in my foot, my right foot.
Mm-hmm.
I had like a little sting, very little, a tiny spot.
Mm-hmm.
I took a shower, and when I came out of the shower, I put some slippers that, with the humidity in my foot, the little, ¿cómo se dice? Costra, the little,
Scab?
well, the sting had a little rough surface that went off.
Mm-hmm.
You know, with the slipper and the humidity in my body, since I was coming out of the shower. I just put on some boots, and I went out, and I told a friend of mine, I said, I'm feeling itchy. My foot is itching me. I don't know what's going on. And she said, let me look at it. She's a microbiologist, my friend. So I showed her, and my foot, not exactly in the sting, but like 4 fingers up. You know, like in the at the surface of my, what do you call it?
The ankle?
The ankle, exactly, at the surface, and like in the middle of my foot. And she said, that doesn't look good. It was like hot, very warm and red. All right. She said, I'll come pick you up on this was Saturday. She said, I'll come pick you up on Monday after work to take you to the doctor. So she did. She came 2 days later to my house, and my whole leg was swollen. Very, very swollen. And they had to help me get to her car. That's how bad it was. I went to the doctor. He said, I can help you, but I have to, you have to stay in the hospital. I said, no, I can't do that. He said, otherwise I cannot help. The thing is, Renan, I didn't ask what's going on with me. You know, they sat me on a wheelchair. They took me to a room, and they registered me in the hospital. And I realized, I remember thinking, I had a great time when I was in the hospital because I was never in pain. It never hurt. My leg was very big and everything, but it never hurt. And I thought, how strange, since I'm curious and nervous, that I'm having, you know, I'm feeling fine after 15 days. Because the doctor said, you can stay, I can help you, maybe in 3 days you'll be out. I spent 15 days in the hospital.
Wow.
And like I say, I didn't have any pain. But I had like altogether 4 operations in my foot. Yeah.
Do you have
my foot, I'm a thin person, and my foot is thin too. But at that time, my foot was so big. I was impressed at the cavity, you know, the depth of the wound. It was like it was like skin becoming black, like dying. My part of my foot was dying. So they started. The thing is that they never made ¿cómo se dice? A study of my blood before they started medicating me.
Qué raro.
They started medicating me immediately. Immediately, and it was. Nobody told me what was the matter. They call it cellulitis, yes, but they didn't tell me how I got this. But I searched myself, and in a massage book about massage, I saw that in the same spot where I had the first sting, it's a tiny spot that it says it's wait. It's like the irrigation of my lymphatic system goes through there, exactly where I have the sting. So my theory is that whatever I caught it, I had it in my blood, you know? By the time I hurt my finger in my hand, I realized there was something wrong in my blood. I didn't know that at the time. But I suppose that when the sting opened and it got close to air, then it started moving within my body. You know what I mean?
Usually,
The thing is, I had tell me.
Usually, the necrotizing fasciitis can be transferred from animal bites or a small cut. It's rare, but you did mention that it was itchy. Can you elaborate a little bit on that?
Well, it was like irritate. My skin was so irritated, and I remember I felt it very warm, very, very warm, and red, like an infection, you know, very, very warm. But the thing is that my my leg was so swollen, was so big, was very big, and I tell you, I had these operations, and they started, you know. I never asked Fernan why I'm in the hospital. Fortunately for me, because my ignorance, in a way, I think saved me. So what the doctors thought, my whole body apparently was collapsing. You know, and they were thinking of cutting, mutilating my leg. I'm very happy I didn't ask, because if they had told me that, I would have been extremely scared. And I was not scared. I wasn't scared. You know, I just felt good. They took care of me. It never hurt. But I didn't know what was really going on. And then the thing is that it got so bad to a point where my whole body was like poison. You know, it was not just my leg that they were thinking of cutting it without knowing where to cut it, what height, you know, to mutilate, but my whole body was, in Spanish is called, Dios, I'll think in a minute. Well, infected, se dice, wait, the word is, I'll think in a minute.
Si quieres me lo puedes decir en español y te digo.
Claro, se llama septicemia. Septicemia.
No lo conozco en inglés.
Well, write it in Spanish and look for it later.
Okay.
Septicemia is that when your whole system gets affected by the bacteria. And I was literally dying. The thing is that when I found out about this, when I came from the hospital, I was brought to my bed, you know, from the street to my bed. I couldn't get up by myself or anything. I stayed in bed like 20 days. But, and I had a nurse come every day to clean up my foot. And that's where I saw how big the wound was. It was in my foot. They made like 3 operations and a plastic surgery.
How would you describe the wound?
4 operations all together. What?
How would you describe the wound? Was it a hole? Was it a scar?
No, it was a hole. A hole, yeah. A big hole. My foot is thin. But I was impressed. I said, how could my thin foot have such a big hole? It was horrible. It was horrible.
Necrotizing fasciitis is known to be able to kill in 3 days if in the right areas. And the reason that they didn't immediately give you a diagnosis and they just straight up started medicating you is because as soon as as soon as the bacteria is even suspected to be in the human body, they immediately need to start treating with antibiotics because of how dangerous and destructive it can be. It literally rots you to the bone.
God, I didn't know that.
Mm-hmm.
And I was so surprised because my wound was very deep.
Mm-hmm.
Absolutely, very deep.
Mm-hmm. You're lucky to be alive. You really are.
I know. I
Mm-hmm.
remember I went out with friends that they came from other countries in Latin America, people related to theater,
Mm-hmm.
friends of mine. I came and we went to a cafe and we started dancing. You know, it was in the afternoon and I started like crying. Tears came out of my eyes. He said, "What's the matter?" I said, "Well, to you it's only a dance, but to me it's a miracle.
Mm-hmm.
You know, to have my 2 feet. I can hardly move, you know, just moving a little bit. And I realized how thankful I was to have my 2 feet. I even made a painting. I painted my doctors in my operation room.
Wow.
Yeah.
That's amazing.
Yeah.
Thank you for sharing
Yes.
that with me, and it was really insightful on how everything works. So, thank you very much for talking about it.
Well, thank you for asking and informing me. I didn't know how, you know, that the bacteria was so moved so fast that I got the antibiotics because I did immediately. They started giving me the shots.
Mm-hmm.
Yeah,
Mm-hmm.
it was incredible. Yeah,
Thank you
I
very
had no
much.
idea it was so dangerous until now that you're letting me know. Yep.
Thank you very much for the interview.
I hope it's useful to you.
It will be, trust me.